Hi, this is Dr. Deborah Goldsmith, infectious disease specialist at Maury Regional Medical Center, and I'd like to talk to you a little bit about how COVID-19 virus affects your lungs. First of all, when somebody has COVID infection, they may not even know they're sick. They can cough, sneeze, or even talk out droplets, and if you're nearby, you can breathe them in or pick them up off of surfaces with your hands and put them in your own eyes, nose, or mouth. Once the virus is in you, it can begin to replicate. There are proteins on the surface of the virus that it uses to bind onto your human cells. Then it dumps RNA, which is its genetic material, into your cells. At that point, the virus commandeers your cell, turning it into a virus factory. More and more virus is made, and eventually that bursts out of the cell, killing that cell, and each of those little virions can go on to affect another cell. Depending on where the virus goes, you can have different symptoms. If it's up above, it can cause changes in your taste and smell. It can cause cough and mild shortness of breath if it's in your respiratory tree. We try to use the drug remdesivir to decrease the amount of viral replication. The virus nonetheless can get down into the lungs, and if it gets down in there, it begins to work on the cells that line the alveoli or the air sacs. As those cells die, they put their debris in the air sacs. Your immune system tries to counteract that. That causes inflammation and fluid in those air sacs, and that makes it harder and harder for your lungs to properly exchange oxygen. We use the anti-inflammatory drug dexamethasone to try to counteract that. Unfortunately, for some people, it's this vicious cycle with more cell death, more inflammation, more fluids until the alveoli collapse and are unable to exchange gas at all. At that point, we can try different things like increasing amounts of oxygen. We can try to use convalescent plasma from people who've already recovered from COVID. If your oxygen levels continue to drop, we may need to put you on the ventilator or the breathing machine. Please be looking for my video when I talk with Dr. Joe Phillip, a critical care doctor, about reasons you might need to go on the ventilator. In the meantime, please wear a mask, wash your hands, socially distance to try to stay safe. Thank you.